second and the largest, went on 10 operating days in hospitals in China last month, performing about 150 surgeries. The group consisted of 20 ENT physicians and 10 members of the A.R.M. Medical Center and offered treatment to Chinese patients who cannot afford the high deductibles required in China. The Israeli team was accompanied by a Chinese medical staff who were exposed to new techniques in the field. With us now is one of the members of the Israeli delegation, Dr. Avi Hefetz, Director of Head and Neck Surgery and Oncology Unit and A.R.M. Medical Center at the Asuta Medical Center. Thank you very much, Dr. Hefetz, for joining us for this.
Thanks for having me.
First of all, we want to hear about this treatment, the specific treatment that we understand in China was either unavailable or too expensive.
Yeah, what exactly as you said, we offered ourselves as volunteers to treat patients that do not have money to pay the co-payment. So we were 20 doctors spread in about 4 hospitals in different small cities, 6-7 million people in each city, and actually merged with the local staff and did surgeries, some of them that they didn't know existed, some of them they did. Some of them they did better than us, I have to admit, but there were a lot of things that both sides were exposed to, which were amazing.
What about the medical facilities you found there? Did you find that you maybe have to bring your own equipment, or was it sufficient what China had to offer?
Yeah, it varied. There were hospitals that some of us felt at home. Everything was there. It was not used. A lot of the equipment was just put there aside. They bought it. They didn't know how to use it. There were some parts of equipment which we didn't have. So they're really high, very sophisticated, but not all of them knew how to use it. And in other hospitals, it was like 20, 30 years backwards. So it was really very different levels in various hospitals.
To what extent would you say that the type of patients that you saw were people really in need maybe of not this surgery, but perhaps others which they cannot afford? Is that mainly the population that you treated?
You know, I think anybody who came to the hospital at that period, and I hope they chose the one who did not have insurance. We could not speak with them because nobody speaks English, which is another problem, very, very interesting problem, but we treated. So we treated whoever came, and the system there, or in all of China, is that there are no outpatient clinics almost. You come to the hospital, you get admitted, they do the exams, they operate, you go home. You may have to wait or drive 2 days to get there and then wait 2 months to get in, but once you're in, within 2-3 days, you get the operation. So it's a completely different system than what we in the Western world are used to. In terms, probably have some advantages, but the level is in these places was not as high as we would expect in China.
And how does this initiative form and come about and finally materialize with you going to China? Where does it start?
Well, it started as our group, who is a top ENT group in the country. We actually gathered together to form something which is better than what we have in the public systems. And after 10 years, we wanted to do something special for 10 years anniversary, and we wanted to go and donate something in the world. So we wanted to go to Africa, but they didn't have the capability of accepting 20 physicians and a big delegation, and they didn't have the equipment, and China did. And their representatives really managed to take it forward and have us all there. It was a unique experience. We felt great about it. The Chinese felt great about it. We discussed about helping each other in the future. For example, I'm pushing a very unique operation, an endoscopic removal of the thyroid gland without a scar in the neck. Actually was invented at Johns Hopkins University in Baltimore by Ralph Tufano, who is a good friend of mine. And we are in Israel, one of the centers that pushed this operation forward, and now it's beginning to widespread all over the world, all over Israel too. And so we got there, and I wanted to do this operation. We did one of those. It was amazing. So it really feels good. It's really an amazing feeling.
We know, of course, that Israeli physicians or Israeli scientists are always known around the world to be at the forefront of high tech, of the innovation. So it must have been quite a culture shock, though, unless you've been before in China, both to you and the team and to them, to the Chinese.
Yeah, for me it was. It was the first time, and it was a culture shock. Not only medical, you know, everything. But they do have, you know, if you go to any guy in the market who sells cockroaches for lunch, he has this WeChat that you can pay with your phone. They don't use money. And the subway, you can go in and look at they look at the face, and it scans them, and they get in. So it's much more advanced than what we here have in Tel Aviv. So we want to think ourselves as better. We're not really better. But in some aspects of, at least in some aspects of medicine, we're better. We have something to offer that they don't have, and they know that. So that's why they want us here. That's why they are willing to send doctors to our center to learn and continue the collaboration between us, which will probably help both sides.
And it's wonderful to see Israelis, and in this case Israeli physicians, who know what we have better here and are willing to share it with the world. Dr. Avi Hefetz, thank you very much for telling us more about this experience and for the work that you do. Thank you for joining us.
Thanks for having me. Thanks.